Ironically, hobo means homeward bound. The homeless have no home. Shelter is a fundamental need that many take for granted. By providing shelter to the homeless, we could decrease the length of hospital stays for the homeless. What is homeless? Envision not having a regular, fixed, adequate nighttime place of residence. The place you found shelter would likely consist of a shelter, car, under a bridge, a tent. Anyone can fall into this vulnerable population. People of all ages, genders, ethnicities, family groups, and educational levels can become homeless. Often, those who are homeless are poor, jobless, and susceptible to substance abuse. Life expectancy of the homeless is 44 years of age. This is half that of the person with a home. Social factors affecting the homeless. Many homeless have poor childhood experiences. 22% of homeless adults suffer from mental illness. They have a high incidence of risky behavior, illicit drug use, and risky sexual practices. Many use public programs such as food stamps, homeless shelters, and food banks. The alcohol consumption rates among men is 58 to 68%. 30% at 30% are women. Almost half are African American. We have the white population, and then Hispanic, Native American, and Asian. The deinstitution of the mentally ill was a legislative decision. It closed many health facilities. The goal was health improvement, a better quality of life. Communities were to develop their own services and programs to help with the management of these mentally ill patients. Some of these patients were placed in supportive community housing. Some were put with their family who were unprepared and had no support. The ones that were supervised were now left unsupervised, no medications. What support programs they did come up with fell through. They didn't work. So, shelter is a fundamental need that many take for granted. And ironically, hobo means homeward bound. The homeless have no home. By providing shelter to the homeless, we could decrease the length of hospital stays for the homeless. And I ask you to envision yourself not having a regular, fixed, adequate nighttime place of residence. The place you found shelter would likely consist of a shelter, a car, or under a bridge. You too can fall vulnerable to this population. People of all ages, gender, ethnicities, family groups, and educational levels can become homeless. And as I said previously, they're jobless and susceptible to substance abuse. Social, cultural, and political factors all contribute to homelessness. Nearly 2 in 3, as I've said, have mental illness. In times of crisis, many homeless people go to the hospital arriving like souls that are lost in the night. The problem? Hospitals are not equipped to meet the needs of these patients. Providing a stable living environment to the homeless will control mental illness. This will promote the health of these people that are hiding in plain sight. Hospitals will profit from the decreased stay of the homeless. The homeless are very susceptible to both physical and mental health problems. People who are homeless are at risk for contracting infections like HIV and tuberculosis. Violent crime is something they have to be confronted with. possibly assaults. Mental illness stands by silently without treatment in many of the homeless. Survival is what homeless spend their days concentrating on: food, water, and shelter. Preserving their health is not priority. The daily struggle for security, food, and safe shelter is a constant. They are simply trying to survive. When the homeless people arrive at the hospital, they're in a crisis. They often have advanced disease and needs that are not medical. This can be very expensive treatment. These needs are very difficult for hospitals to manage, resulting in lengthy hospital stays. Psychiatric admissions are 100 times higher in the homeless. This is a result of lack of primary care physicians. Medication compliance is rare due to decreased funds and resources. Ignoring their health care is a result of the daily struggles they have finding shelter. The homeless are more likely to have an average of a 4-day longer hospital stay. The average cost to cure alcohol-related illness is $10,000. Homeless patients on medical and surgical services remain hospitalized longer than house patients, resulting in substantial excess costs. Homeless patients admitted for psychiatric conditions have higher costs not explained by prolonged length of stay. The rates of mental and physical illnesses are high among the homeless. Their access to health services is more difficult. They often do not have a regular source of health care, and the daily struggle for food and shelter may take priority over mental health care. Poor access to the community service result in hospital overutilization. Healthcare professionals, particularly community nurses, have opportunities to make a change. We can say it is not our responsibility to take care of the homeless, but doing so protects the rest of the population by not spreading disease. Commonly, we think of homeless as beggars walking around looking for charity. We should be measured as a society by the way we treat our most vulnerable members. Our government should be doing much more than it is for the homeless. There is no segment of the population with less access to health care than is the homeless. The only time many of these homeless get to see a doctor is during a visit to the emergency room. Homeless people are very susceptible to both physical and mental health problems. Poor access to community service result in hospital overutilization. The homeless are like birds without nests. Providing a stable environment for the homeless will aid in controlling mental illness. It will also increase hospitals' revenue.